Total parenteral administration. What's the difference between enteral and parenteral feeding? The terms enteral and parenteral sound look similar, but there are two different things. Enteral feeding. Enteral feeding refers to liquid nutrition processed by the gastrointestinal tract. Individuals who are prescribed enteral feeding consume their meals through a tube that connects to their stomach or small intestine. Sometimes enteral feeding provides supplemental nutrition. Other times, it accounts for a patient's entire caloric intake. Parental feeding. Parental feeding refers to liquid nutrition processed by the veins. It's considered riskier than enteral feeding, but often result is improved health and energy. Some people undergo parenteral feeding while recovering from surgery or other medical procedures, while others require it long term. There are several reasons someone might need enteral or parenteral nutrition. Enteral nutrition. Enteral nutrition reduces the risk of malnourishment or a lack of vitamins, minerals, and nutrients. If your loved one isn't able to eat enough calories throughout the day, they are more likely to lose weight and experience serious health problems. Common conditions that may benefit from enteral feeding include a stroke, cancer, dysphagia, difficulty swallowing, neurologic or movement disorders, Parkinson's disease or Alzheimer's disease, critical injuries. See our enteral feeding formulas or speak with one of our friendly customer care specialists by calling. Parenteral nutrition is like enteral nutrition in that it helps prevent malnourishment. However, it's designed to assist individuals who have gastrointestinal issues that prevent them from properly digesting food. Common conditions that may benefit from parenteral nutrition include Crohn's disease, cancer, short bowel syndrome, ischemic bowel disease, low blood flow to the bowels. Parenteral feeding administers sugar, carbohydrates, proteins, lipids, and other nutrients through a needle and into a vein. These nutrients ensure your loved one receives the energy and hydration they need to thrive. What are the types of enteral versus parenteral feeding? Enteral and parenteral feeding fall into several subcategories. Your loved one's primary care physician makes a recommendation based on their age, current health, medical history, and nutritional needs. There are six main types of enteral feeding include nasogastric tube, NGT. A nasogastric tube is inserted through a nostril and into the stomach. Orgastic tube, UGT, an orgastic tube is inserted through the mouth and into the stomach. Nasenteric tube, a nasenteric tube is inserted through a nostril and into the intestine. There are two subtypes of nasenteric tube, including nasovaginal tubes and nasoduodenal tubes. These tubes are run into a specific part of the intestine, either the jejunum or duodenum. Orienteric tube. An orienteric tube is inserted through the mouth and into the intestines. Gastrostomy tube. A gastrostomy tube is inserted through a small incision in the abdomen directly into the stomach. Jejunum tube. A jejunostomy tube is inserted through a small incision in the abdomen directly into the jejunum, a part of the small intestine. As previously mentioned, parenteral feeding is designed for people with gastrointestinal or digestive issues. There are two main types of parenteral feeding, including first, total parenteral nutrition or TPN. If your loved one has long-term nutritional needs, they receive TPN. TPN requires a brief outpatient procedure. It involves a medical provider inserting a central catheter into the superior vena cava, a major vein that carries blood from the head and chest to the heart. To make the feeding process easier, your loved one's primary care provider might also recommended installing a needleless access part. Peripheral parenteral nutrition or PPN. If your loved one is recovering from an operation or another medical procedure and only has short-term nutritional needs, they receive PPN. PPN is administered through a traditional external instead of an enteral one. Thus, enteral or parenteral nutrition present risk. Enteral and parenteral nutrition are considered safe and usually well tolerated. Even so, it's important to understand their risk. Potential side effects of enteral nutrition include food getting into the lungs, aspiration, infection of the tube or insertion site, nausea and vomiting, diarrhea, skin irritation, tube blockage, tube dislodgement. If your loved one only needs enteral nutrition for a short time, they might also experience gastrointestinal discomfort as they readjust to solid foods. Potential side effects of parenteral nutrition include catheter infections, blood clots, liver disease, bone disease, fatigue, memory loss, increased urination. To reduce the risk of these and other issues, it's crucial to regularly clean and sterilize each feeding component including tubes, catheters, and needleless access ports. If you have any question about proper hygiene or sanitation, speak with your loved one's primary care physician. This lesson for the day. This is the endocrine system. The hypobalance, the female body, the primary, thymus, thyroid, and paratozoids, heart, and this is the endocrine system. It's a complex network of glands and organs. It issues hormones to control and coordinate your body's metabolisms, energy level, reproduction, growth, and development, and responds to injury, stress, and mood. The following are integral parts of the endocrine system. Anatomy of the endocrine system in males and females. Hypothalamus. The hypothalamus is located at the base of the brain, near the optic chest chems, where the optic nerves behind each eye cross and meet. The hypothalamus secretes hormones that stimulate or suppress the release of hormones in the pituitary gland. In addition to controlling water balance, sleep temperature, appetite, and blood pressure. Pineal body. The pineal body is located below the corpus callosum. In the middle of the brain, it produces the hormone melatonin, which helps the body know when it's time to sleep. Pineal body. The pineal body is located below the corpus callosum. In the middle of the brain, it produces the hormone melatonin, which helps the body know when it's time to sleep. Pituitary. The pituitary gland is located below the brain, usually no larger than a pea. The gland controls many functions of the other endocrine glands, thyroid and parathyroid. The thyroid gland and parathyroid glands are located in front of the neck, below the larynx. The thyroid plays an important role in the body's metabolism. The parathyroid glands play an important role in the regulation of the body's calcium balance. Thymus. The thymus is located in the upper part of the chest and produces white blood cells that fight infection and destroy abnormal cells. Adrenal gland. An gland is located on top of each kidney, like mini glands that adrenal glands work hand in hand with the hypothalamus and pituitary gland. The adrenal glands and make release corticosteroid hormones and epinephrine that maintain blood pressure and regulate metabolism. Pancreas. The pancreas is located across the back of the abdomen behind the stomach. The pancreas plays a role in digestion as well as hormone production. Hormones produced by the pancreas include insulin and glucagon, which regulate levels of blood sugar. Ovary. A woman's ovaries are located on the both sides of the uterus, below the opening of the fallopian tubes, that extend from the uterus to the ovaries. In addition to containing the egg cells necessary for reproduction, the ovaries also produce estrogen and progesterone. Testes. A man's testes are located in a pouch that hangs suspended outside the male body. The testes produce testosterone, and sperm. What is the endocrine system? Endocrine system, also referred to as hormone systems, are found in full mammals, birds, fish, and many other types of living organisms. They are made of glands locate throughout the body many hormones that are made by the glands and released into the bloodstream or the fluid surrounding cells and receptors in various organs and tissues that recognize and respond to the hormones. How can chemicals affect the endocrine system? Scientific research on human epidemiology, laboratory animals, and fish and wildlife suggests the that environmental contaminants can disrupt the endocrine system, leading to adverse health consequences. It is important to gain a better understanding of what concentration of chemicals found in the environment may cause an adverse effect. Various types of scientific studies. Epidemiology, mammalian toxicology, and ecological toxicology are necessary to resolve many of the scientific questions and uncertainty surrounding the endocrine disruptor issue. Many such studies are currently underway by government agencies, industry, and academia. This is the example of enteral axis, enteral and parenteral, the long-term vascular axis for parenteral nutrition.